If you are coughing for more than 3 weeks, remember it is not normal. Time for you to go and check. Prolonged cough could be related to a lot of diseases, a lot of problems. Usually when you have URTI, upper respiratory tract infection, if the infection go a bit more lower, it could lead to lung infection, pneumonia. That could be one of the cause for prolonged cough. So viral infection or bacterial infection. So if it is viral infection, usually you just have to hydrate yourself, take cough mixture and rest well. It should be subsiding. But if it is bacterial infection, you need to put yourself on antibiotic. Of course, don't start yourself. You have to visit a doctor. Doctor will start you on antibiotic based on the blood test result. After 3 weeks, you are still coughing. Then you have to investigate other causes. It could be tuberculosis. Tuberculosis, yes, still common in Malaysia because we have a lot of foreigners from Indonesia, from India. They are always coming, or those who traveling. It could be the reason you would have got infected and then you are coming back to Malaysia and you have this prolonged cough. So the sign of tuberculosis, or we call it TB, could be weight loss, coughing more than 3 weeks, sometimes blood in the sputum. When you cough, you will cough out blood, and night sweat. You will have night sweat and persistent cough. So when you have that, you go to the clinic, clinic kesihatan especially, they will do the Mentus test to see whether you have tuberculosis or not. If you have TB, there are treatment available for that. You have to be on treatment and isolate yourself so that you don't spread it to other people. Other causes of prolonged cough could be allergic. Do you have allergic rhinitis? So when you have allergic rhinitis, meaning when you wake up, you have this sneezing, and that could relate to coughing, and you have post-nasal drip. There's a lot of sputum which is actually dropping at the back, and that could irritate your throat and it cause coughing. So then there's nasal spray which is available. Of course, you need to go and see an ENT doctor. They will start you on some nasal spray and all that. And also could be because of some medication. If you're on some high blood pressure medication or some other medication, sometimes it also can cause persistent cough. So if there's changes in your medication and that triggered coughing, you have to inform your doctor. So when you have all this coughing for a very long time, of course you need to do a chest x-ray to see whether your lung is in a good condition or not, and then we'll do a sputum test just to rule out whether you have tuberculosis or not, or if you have allergic, then there's allergic test where a lot of allergens will be checked, and you have if you're allergic to specific thing, there's allergic test available. So a lot of allergens will be tested. It's a blood test. If you're allergic to certain allergens, then you just have to avoid all these allergens. So coughing more than 3 weeks, remember, visit your nearest doctor.